1 in 4 of us will experience mental health problems in our lives. The cost to the economy is over £100 billion a year. The cost of treatment will double over the next 20 years. And yet these problems are relatively poorly understood.
We have a problem in mental health. In fact, I think it's a problem in medicine generally, in that we've got a gap between our research activities and our clinical practice, and that is that research, information and activity has surprisingly little impact on clinical practice on the front line.
Mental illness are described with broad categories like depression, anxiety, schizophrenia, under the assumption that these descriptive categories reflect underlying biological entities. I think that's probably not the case. I think by using the tools of neuroscience, we can parse up that whole domain of mental illness into something that is much more scientifically plausible.
The UCL Partners Mental Health and Wellbeing Programme unites one of the world's largest scientific research programs, educational programs and cutting-edge clinical services into a single group aiming to deliver the most rigorous and comprehensive, scientifically grounded clinical services in the United Kingdom.
There's concern about people in the universities doing research that might be one step removed from what's going to be practically useful. But this is a real chance for the universities and the trust to talk together and work together more closely and say, how can we enhance the research and also enhance health and health services?
Researchers at UCL Partners have made and continue to make some of the most significant breakthroughs in research into mental health.
We published a manual on cognitive stimulation therapy, which is now very widely available, and people are running the groups up and down the country. I think this kind of research, which makes a practical difference to people with problems such as dementia or other chronic disorders, is going to grow in importance immensely.
We showed that depression wasn't some fuzzy psychiatric in quotes concept that's quite apart from biomedicine. It's another illness that can be predicted just like heart disease. And we think this may be very important in prevention. If we can identify the people who are at risk, then we might be able to intervene before they become depressed.
Much progress has been achieved in mental health research over the last decades, but much more needs to be done if what we have learned is to be put to the service of those who truly need it.
We need much more applied research. We need to know which treatments work, and if they work, how do they work? What's the mechanism of the treatments? And then we need to know much more about the etiology of the conditions, and the etiology is not always in the brain. You know, we're all subject to all sorts of stresses, so we need to know what's going on out there that's leading to this almost epidemic of mental illness.
We have a duty to the people that we are involved in treating and supporting to provide the best treatment for them. So I think it's about improving the whole process of the identification of underlying problems, the translation of that into more effective treatments, and then communicating not just to professionals about how treatments might be improved, but also very much involving patients, their families and the wider public in that debate.
We need to be not only intervening in early years, we need to be intervening in terms of protective factors such as parenting, such as the built environment, such as education, to reduce the prevalence of mental ill health.
UCL Partners provides an exciting opportunity for practitioners, for educators and for researchers to share their knowledge and enthusiasm, to combine their energy, to provide for the new century a fresh solution to this, one of the greatest problems that humanity faces, the problem of mental ill health.